premiums are set to jump again next year, rising twice as fast as inflation. Open enrollment begins November 1st in California, and analysts say the surge could hit both workers and employers hard. To help break down what's driving the rising costs and what consumers can expect next year, we're joined by Glenn Melnick, a professor of health economics and finance at the University of Southern California. Glenn, thank you for joining us this morning.
Happy to be here.
All right. So, Glenn, as we said just a moment ago, open enrollment starts November 1st here in California. How much can the average person expect to pay for coverage through an employer-provided coverage plan?
The news is not good. The news is not good at all for consumers. Premiums have been growing over time, but relatively slowly. Now they're forecast to begin to surge. And I'm worried that not only this year, but they're going to continue to go at double the rate of overall inflation, if not higher.
I mean, this is incredible here. We're talking about 6 to 7% here is what the average family could pay, paycheck deductions of $8,900 a year for coverage for families here. The jump in health insurance costs are partly due to increased demand for costly treatments such as GLP-1 drugs used for weight loss. But what are some other reasons for this massive increase here for employees across the country here in California?
So two things. One is the main driver in California across the country is rising prices charged by healthcare providers, especially hospitals. All right, so if you look at the data, hospital prices have surged in the last 24 months for commercially insured patients. So for example, our data in California looked at since the end of COVID, prices for commercially insured patients went up about $7,000 or $8,000 for each stay in the hospital, whereas Medicare paid only $700 more over that same period.
So what's the hospital's reasoning for raising these costs and in return affecting health insurance companies and, of course, affecting employees?
Right, no, you're exactly right. So, well, one of the reasons is during COVID, there was a surge in input price costs. So wages went up, other things went up. And so part of it is catch up. But my concern as a health economist now is the market has become so concentrated in many parts of California that providers really can raise their prices to a degree where consumers and health plans have no choice but to include them in their plans and pay these higher prices.
Okay, so then, go ahead, I'm sorry.
Well, so one thing that's really disturbing, though, is that most people don't understand is they think that their employer is paying the entire, most of their health insurance bill. And that's not exactly correct from an economic perspective. Your employer pays up front, but then next year says, all right, can I give this worker a raise? So the average wage in California is $26 an hour. If health and premiums are going up $1,000 or $2,000, that's money that the employer will not give the workers a raise. So our big concern is that millions of workers in California, because of rising health insurance costs, will never see a raise again.
That is the fallout from all of this, because we also have people paying more for groceries, and now you are sticking them with a higher insurance bill, and they have to pay these premiums because they need to cover themselves. Nearly 168 million people across the country are covered by their workplace here, and they would be affected by this increase. Is there any way for employees to stave off these rising costs with open enrollment around the corner?
Yeah, employees are fairly helpless here because it's a market-driven phenomenon. California has passed a law and implemented an agency to try to slow, and it's the Office of Healthcare Affordability, to try to slow healthcare spending growth. As you might imagine, the hospitals and other groups are fighting against that. But if consumers want to do something, they should write letters in support of slowing the growth of healthcare spending, so that their budgets, household budgets, are not deteriorating every year.
It's also should be noted Americans pay double what residents in other developed nations pay for health care, even though outcomes in the U.S. are worse than those in other countries. Glenn, I wish we had more time to talk.
Yeah.
We'll try to check in with you again. Glenn Melnick, professor of health and economics and finance at the University of Southern California. Thank you for joining me this morning.
My pleasure.